Alcohol consumption has been associated with a variety of cardiovascular diseases. Alcohol intake, possible physical signs of alcohol abuse like parotid disease, telangiectasia or spider angiomata, mental status changes, cirrhosis, heart failure, and supportive evidence consistent with dilated cardiomyopathy. What does alcohol do in our body? Inhibition of protein synthesis. Inhibition of oxidative phosphorylation. Fatty acid ester accumulation. Free radical damage. Inhibition of calcium myofilament interaction. Inflammatory and immunologic factors receptor abnormalities. Disruption of cell membrane structure. Coronary vasospasm. Synergy with concomitant conditions. Activation of the renin-angiotensin system. Some studies have suggested that a genetic vulnerability exists to the myocardial effects of alcohol consumption. Individuals with certain mitochondrial deoxyribonucleic acid, DNA, mutations and angiotensin-converting enzyme, ACE, genotypes, DD genotype, may be particularly susceptible to the damaging effects of alcohol. Exactly how these genetic variables create this higher risk is not known. Cardiac effects of alcohol. Mitochondrial dysfunction is known to have a significant role in the development and complications of alcoholic cardiomyopathy. Long-term alcohol use has been linked to damage of mitochondrial DNA, increasing the risk of mutations. Cardiovascular changes. Cardiac percussion and palpation reveal evidence of an enlarged heart with a laterally displaced and diffuse point of maximal impulse. Auscultation can help to reveal the apical murmur of mitral regurgitation and the lower parasternal murmur of tricuspid regurgitation secondary to papillary muscle displacement and dysfunction. Third and fourth heart sounds can be heard, and they signify systolic and diastolic dysfunction. Pulmonary rales signify pulmonary congestion secondary to elevated left atrial and left ventricular end diastolic pressures. Jugular venous distension, peripheral edema, and hepatomegaly are evidence of elevated right heart pressures and right ventricular dysfunction. Laboratory investigations: elevation of creatine kinase, LDH, malic dehydrogenase, and alpha-hydroxybutyric dehydrogenase levels in alcohol-mediated dilated cardiomyopathy. Echocardiography findings in excessive alcohol intake. Chambers dilatation. Globally decreased ventricular function. Mitral and tricuspid regurgitation. Pulmonary hypertension. Evidence of diastolic dysfunction. These changes can be seen even in the absence of systolic dysfunction but seem to be more prevalent in patients with coexisting systolic dysfunction. The progression of diastolic dysfunction in asymptomatic individuals may be related to the duration of alcoholism. Intracardiac thrombus. Left ventricular hypertrophy. ECG changes in alcoholic cardiomyopathy. Conduction disturbances, such as degrees of atrioventricular block, left or right bundle branch block, and hemiblocks, are also observed. Criteria associated with left ventricular hypertrophy with a repolarization abnormality, prolonged repolarization, nonspecific ST and T wave changes, and Q waves have also been described. Electrolytes abnormalities. Electrolyte abnormalities including hypokalemia, hypomagnesemia, and hypophosphatemia, should be corrected promptly because of the risk of arrhythmia and sudden death. Treatment for alcoholic cardiomyopathy. Abstention from alcohol. ACE inhibitors. Angiotensin receptor blockers. Nitrates. Hydrolysine. Digoxin. Diuretics. Beta blockers. Anticoagulation. Intravenous inotropic agents. Cardiac transplantation. Alcohol and pregnant women. Pregnant women should not drink. It can seriously harm the baby and may cause birth defects or fetal alcohol syndrome. If you're breastfeeding your newborn, be aware there may be an association between alcohol in breast milk and reduced thinking and reasoning skills in the child at a later age. So, it may be best to avoid drinking alcohol while breastfeeding. Aspirin and alcohol, are they safe in combine? People who take aspirin regularly are at risk for stomach problems, including gastric ulcer bleeding. Alcohol use can increase ulcer risks, so ask your doctor if it is safe for you to drink alcohol in mild to moderation. Before taking any over-the-counter or prescription medication, check with your doctor about any potential interactions with alcohol. Is small amount of alcohol good for health? Even a small amount can affect important functions like speech and movement. Drinking very large amounts all at once can slow your heart rate and breathing down to a dangerously low level. If you drink regularly, you might feel like alcohol doesn't affect you as much, but this usually means you've developed a tolerance to some of the effects. Remember, the more you drink, the more damage you can cause. Is it safe to drink alcohol after coronary artery bypass surgery? In hospital, your medications are adjusted to control your blood pressure, but you aren't drinking alcohol at that time. Back home, if you start drinking regularly again and your blood pressure changes, your cardiologist can alter your medications. Your doctor will often advise you when it's safe to start drinking alcohol again, from a medical perspective. Psychologically, however, many people feel low in mood after they're discharged home, especially following open heart surgery. Can my cardiac medications interact with alcohol? For a lot of people on long-term medications, alcohol can make the drug less effective. If you take medications for diabetes, or you're on an anticoagulant like warfarin, rivaroxaban, dabigatran, apixaban, and endoxapan, drinking alcohol can affect the way these drugs work, so it's important to speak to your cardiologist. Alcohol also causes damage to the liver over time, especially if you drink too much. Medications such as statins that act directly on the liver can cause further damage when combined with alcohol. If you do drink, stay within the low-risk limits. Drinking alcohol will protect me from COVID-19 infection? It is harmful in COVID-19 infection. It does not protect you from COVID-19. Inversely, it increases mortality rate. Would alcohol drinking cause heart attack? Binge drinking is the quick, high-volume consumption of alcohol can force you to become rapidly intoxicated, which can cause all kinds of harm to the body and even heart attack. Can I continue a amiodarone drug with alcohol? No, it can cause serious side effects, and it might lead to arrhythmia. Is there any beneficial effect in alcohol? Consumption of 1 or 2 drinks per day is associated with a reduction in risk of approximately 30% to 50%. 15 studies of coronary narrowings defined by cardiac catheterization or autopsy show a reduction in atherosclerosis in persons who consume moderate amounts of alcohol. How long one can drink alcohol in their life? The risks and benefits of alcohol consumption should be reviewed periodically as part of regular medical care. In the event of excess consumption, problem drinking, or deleterious consequences of drinking, recommendations for alcohol consumption should be revised. Is alcohol safe for chronic kidney disease patient? Mild alcohol drinking may be okay for people with chronic kidney disease who are not on dialysis. However, it's best to first check with your nephrologist or renal dietitian to find out if alcohol is safe for you. If you're able to drink alcohol safely, your healthcare team will advise you on the types and amounts that are right for you. Alcohol is a double-edged sword for CKD and ESRD patients. Is alcohol-related liver disease more serious? ARLD does not usually cause any symptoms until the liver has been severely damaged. When this happens, symptoms can include feeling sick, weight loss, loss of appetite, yellowing of the eyes and skin, swelling in the ankles and tummy, confusion or drowsiness, vomiting blood or passing blood in your stools. This means ARLD is frequently diagnosed during tests for other conditions, or at a stage of advanced liver damage. If you regularly drink alcohol to excess, tell your physician or hepatologist, so they can check if your liver is damaged,